It actually started back in 2004. We have a postgraduate training program at the National Library of Medicine that for a year we bring recent library school graduates to spend time at the National Library of Medicine learning how the library operates. We decided that we would focus on sub-Saharan Africa. And the thought along the way came up that when this cadre of librarians, however many there were that had been to the National Library of Medicine, went back to their countries, they would begin to build a network, which became the Network of African Medical Librarians. Now, we had 5 associates. Nancy was our first international associate. She came for a year.
Hello, I am Nancy Kamau. I'm the Deputy University Librarian, Kenya Methodist University.
Grace was one.
Hello, my name is Grace Ajumo. I'm a medical librarian at Ilatunde Odeku Medical Library, College of Medicine, University of Ibadan.
Christine was early on.
Hello, my name is Christine Wamima Kanyengo. I'm the Deputy University Librarian at the University of Zambia.
Abdaan.
Hello, my name is Abdaan. I'm a medical librarian at the University of Bamako in Mali.
And we had a couple of others who are not here. We had Cristina Horta from Mozambique.
Boas-vindas. Sou Cristina Horta, bibliotecária de Ciências de Saúde de Moçambique.
And we had another colleague from Morocco. So over the years, that's how the network was created. So that is the network. And the network has existed prior to the project, the ADHL. The ADHL project grew up from the librarians in the network as something that you all wanted to do. So they kind of work hand in hand, basically.
In recalling the earlier days of this group, remind everyone, and some of the new folks might not be aware, this project to create digital repositories for health came from you. It didn't come from us. And one of the early pioneers of this in this group is Abdaan from Mali. We've been involved as kind of coaches and facilitators for some years now, but you are most definitely the leaders, and we're very proud of that and hope you are too.
In getting to that point, what challenges you feel you still have to overcome to get your repository fully functioning?
If I stand there and begin to talk about challenges, we won't live here. The challenges are so enormous. Some of them are system challenges, institutional challenges. And then we have challenge with electricity supply. When you are dealing with electricity, is an issue. And then when the power is on, the internet is down. Every day there is one problem or the other.
So the challenges, we have had staff turnover quite a bit when somebody has been trained and now they are able to do whatever you expect them to do. They move out. They get a better job or a better pay.
The challenges is we still do not have a formal institutional policy in place. So the institutional infrastructure is very poor. So we have to rely on partners such as the one who is helping the malaria research project, and also to rely on initiatives such as Maliran.
Many projects, particularly projects in our countries, they operate on a silo approach, where an institution has got a small grant or whatever grant, they think of implementing that grant without involving other important key stakeholders.
Yes, the challenges were there, but I don't think there are challenges that we cannot work on.
The question of sustainability is really central to all of this.
We shall continue the digitization and archiving the process, which will be an ongoing. Whether the project comes to an end or not, digitization and the archiving at the Medical Library, University of Zambia will continue because we have the ability, we have the capacity to carry on. So we shall carry on. The work will not come to an end after the project comes to an end.
At the University of Ibadan, we are taking home how they've been able to put in place a single license for their repository, which has been a real issue for us.
One of the things that we are intending to do is, the first thing is that we want to increase the number of items in our pilot DHL.
There is a lot of information in Kenya in health, and it's isolated. Each university has its own, and I think the future is to be able to bring all this information together.
Julius in Mali, now so we worked and pushed small by small. Now we have a better internet connection to the library. So we had a fiber optic connection hooked to the main university backbone.
Sensitize policymakers. That is the main thing, and researchers. But policymakers, if your policymakers cannot support you, you will never succeed.
3 paradigms of development. The first one is colonial, and all the arrows are going down. That means, somebody comes from the US and says, okay, you guys go out in the field and do this collection for me, and then takes that information away, publishes it, and the people back where that research was done never see the results of it. And you are a key intervention in helping make that research come back and serve the people.